Sexual violence is usually a weapon in war.
Sexual violence is a feature in conflicts around the world and often used as a strategy. Throughout history, belligerent and radical parties have been using rape as a tool to punish, terrorize, and destroy populations. In some cases, armies, rebel groups, and terrorist organizations employ sexual violation as a strategy to pursue their objectives. In other cases, commanders allow their soldiers to rape women and girls as a form of reward. The nature of sexual violence during wartime is often committed in public and by several attackers, which includes gang rape, attacks with objects and weapons which are inserted in the victim's reproductive organs. However, wartime rape attacks affects both women and men, as men can be victims and women the perpetrators. But what does the law say about this? The international law conflict-related sexual violence are characterized as war crimes against humanity. Victims are at a higher chances of contracting diseases. Sexual violence destroys family ties and inflicts harm over generations. The intention of this kind of strategy is to humiliate the enemy. My name is Kabyanga Derek, and this story examines the specific long-term health consequences of war related to sexual violence among women. There have been different studies and researches conducted by different scholars about the long-term consequences of wartime sexual violence. And with these researches, we'll be looking into them deeply and studying them, finding out on the different consequences that they came about, that these people, the victims or the survivors of the sexual violence conducted by different armies, different soldiers, different troops, and different people for different reasons, as we're going to be looking into this story. A study by Eugene Chianda and other fellow authors, war related to sexual violence and its medical and psychological consequences, are seen in Kitgum, northern Uganda, published on 10th November 2010, indicates the long-term consequences, which includes reproductive health consequences, surgical problems, and psychological health problems in the survivors. The study further breaks down each consequences into other consequences that avail. The reproductive consequences include pain in both external and internal genitalia, menstrual disturbances, urination and infection problems like sexual dysfunctions, STDs, HIV/AIDS, and disturbances of reproduction and infertility. Mallet Atakilt Woldesadik study long-term effects of wartime sexual violence on women and families indicated that wartime sexual violence has catastrophic effects on health and the well-being of survivors. However, there is evidence on its long-term effects on survivors. Findings of this study show that women survivors continue to suffer from unresolved and untreated trauma, lack access to mental health care, and face economic hardships due to community stigma and customary laws that prevent women from owning land. Family members to the survivors have as well been affected by the traumatic stress and stigmatization that comes along to their members. We ask, however, what has the family done to ensure that their family member who happens to be a survivor gets the peace and also restored back? 2. What should the people who stay around the victim's family do to help the survivor recover from this? And 3. What has the leadership done to ensure survivors get justice and also enjoy their freedoms and rights as opposed to the cultural laws? In February 2019, the Sexual Offences Bill was enacted, which consolidates a number of previous laws regarding sexual offences. But the question to ask is, what has the government done to ensure that the survivors of wartime sexual violence gain their freedom back? Derek Kabyanga reporting.